Welcome to Afya Fix. Thank you for joining us. With me today is Dr. Eddie Ramirez. Dr. Eddie Ramirez is a lifestyle medicine doctor. He's an international speaker, and he is a researcher. We're so glad to have you, Daktari. Karibu sana. And I also have a live audience with me who are going to be part of this program. And you, of course, are going to engage us from home. I'm your host, Gladys Ombongi, a nutritionist with Lishe Leo. Karibuni sana. Daktari, today we want to talk about inflammation and diet. That's our topic today. I don't know what is inflammation. It's a big name. People talk about it all the time. Tell us, what is it?
Yes, so basically it is a mechanism that we have inside our body that help us deal with when our tissues get injured. For example, if you are playing soccer and you twist your ankle, inflammation immediately starts there. And you can actually remember that process. You know, what's going to happen to your ankle? It's going to get swollen.
Yes.
It's going to get red. It's going to get warm if you put your hand and compare with the other leg, you know, and it's going to get red. So redness, the pain, and then the fact that is painful, it helps you to understand that something is wrong. You know, you shouldn't be using that leg and so forth. The redness is because there's more blood flow to the area that is starting to start the process of healing. And then the swelling is a way that the body tries to cordon the injury. It tries to stop other things from coming in there. So that process of inflammation is there because we need it. It's for the healing of our tissues. Same story happens if you burn yourself. You're going to feel the same things. If you poke yourself with a needle, you're going to see the same things. And over and over and over, anytime we injure our bodies, we will respond with this inflammation.
Beautiful. Now that is inflammation. You have actually articulated it very well. Is it only, do we have only one type of inflammation? Are there different types?
That's a very good question. And you know, back in 1850, Dr. Virchow, a tremendously wise physician from Germany, started to realize that he was seeing a certain pattern. Most of the diseases that he was seeing, the chronic type of diseases, such as dementia, such as osteoarthritis, such as heart disease, and so forth, he realized that they had something in common. Every single one of them had chronic inflammation as a common denominator. In other words, the origin of these problems was not bad luck, as we have been talking about, but it had to do with chronic inflammation. Now, the inflammation that I described you just a minute ago, that is what is called acute inflammation. So acute inflammation remains as long as the injury or the tissue is damaged. Then once things are solved, you know, once your ankle, you know, gets healed, depending on severity, you know, so if it's very severe, you know, it's going to take a few weeks. If it's something more mild, within days, then the body shuts down inflammation. See, that's acute inflammation. What we're talking about here is something that is called chronic low-level inflammation. So that chronic low-level inflammation is the problem. And then when we see in the panorama internationally, you know, we see certain patterns. We see, for example, in America, you know, many people eat what is called the SAD diet. And it's true, that's what it's called in the scientific literature, which means the standard American diet, which actually will make you sad for sure. It's not the best thing to be eating. So as other Western countries, you know, follow along with this highly processed and so forth, we start seeing that pattern worldwide.
So there we have two types of inflammation. You said acute and chronic. And so is it dangerous to have inflammation in your body? Why should I be concerned?
That's right. You know, it's the way I like to explain it to my patients is as if you have a source of heat in your home. You know, let's say you live up in the mountains and you have one of those fireplaces. You know, you put wood there and then it burns and then it generates heat. See, as long as the fire stays within the confines of the fireplace, everybody's happy.
Of course.
So you are warm, the fire is there, everything works very nicely. You know, your home is going to be nice and warm. But what happens if I start putting a bunch of wood in that fireplace and it even starts piling out, you know, outside of the fireplace, you know? What's going to happen sooner or later?
You don't want it outside.
Disaster is going to be the result of that. As those fires are going to start coming out of that fireplace, and that fire is going to start reaching out to your walls and to your furniture and so forth, man, this is not going to end up so pretty. No. This is going to be a disaster. And that's exactly what many people don't realize regarding chronic inflammation. In fact, one of the biggest problems with chronic inflammation is that you don't have symptoms. It doesn't hurt. You don't see that it's red. You don't see the swelling. You know, like the acute inflammation, you saw those symptoms. With chronic inflammation, other than maybe a little bit of fogginess in your head and tiredness overall. And so people think, oh, well, because I'm just getting old. You know, that's the reason why, you know, I'm feeling like this, you know. But you don't realize that the fires of chronic inflammation are starting to creep out. And man, you better stop that, because disaster is going to be the result of this.
So that there you have actually put it even much clearer. So will it eventually affect one's body? What will it lead to if you constantly are having an inflamed body?
That's right. So the problem with having that chronic inflammation is that one of the biggest blessings we have in our body, which is our immune system, our immune system actually starts attacking us. Not like an autoimmune disease, but in a different way. For example, the immune system starts getting busy and starts clogging in your arteries. Therefore, you're increased risk for heart attack and stroke. Your inflammation in your brain starts to break down the nervous connection between one nerve cell and the other nerve cell. Is that going to be good? No. You keep doing this. I mean, you have billions of these connections, but you keep doing this day in and day out, I can assure you, you're going to end up with a severe problem like Alzheimer's or dementia. For example, your bones. Between each of your bones, you have this cartilage that is supposed to lubricate and help you move your joints. If you have chronic inflammation, the joints start to create peaks and valleys. Instead of being nice and smooth, you create these peaks and valleys. And the person complains, doctor, when I move my leg, somehow I feel something hurts there. Doctor, you know, in my back, you know, I have this pain that just doesn't go away when I move my back and so forth. My joint, you know, I have this pain. Every time I move my leg, I feel something here in my hip. Chronic inflammation. See, there is no need for you to have this type of problems. In fact, interesting studies. People that are in the countryside, you know, working hard with their hoe and so forth, and you go and check those joints, they're nice and smooth. Well, the people that are in the cities that don't move, no exercise, and chronic inflammation, about the same age, you see this malformation there, creating on their joints and so forth, secondary to that chronic inflammation. And also, one big killer, sadly, here in Kenya, cancer. You keep putting chronic inflammation on your cells, specifically happens to be the area that you have that inflammation, and those cells are gonna transform into cancer cells. So that's why you don't fool around with this type of things.
And I'm just thinking of this person who may come complaining to you, doctor, I have this back pain. And when they do an x-ray in the labs, they find it's completely worn out. They don't have any more, the cartilage.
Yes.
What does that mean? Is it because they have been inflamed in that area only, or the entire body?
That's right. Yeah. Sometimes has to do with a little injury that because of the chronic inflammation make things worse, and sometimes has to do with the areas of our bodies that we're using a lot. So yeah, that's various things that affect that. But I can tell you, it's not nice to have that kind of problem. I mean, today we have surgeries. We can chop off your leg and put a piece of metal there instead of your cartilage. It's a super expensive surgery, high risk of you getting a bone type of infection, and it's never the same. The way that God made it is just like exactly how it should be. When man, tries to replicate that, sure, you can do certain things that you used to do, but still, it's not exactly as the way that God made it.
Okay. But is there any role that diet plays in inflammation?
So what we are finding out is that diet in today's society is one of the main causes of inflammation. And let me put it this way. There's many sources of inflammation, but let's focus right now on the diet. So there is something inside each of our cells. This is the most complicated word we're going to use. It's called arachidonic acid. So arachidonic acid is just basically a chemical compound that is in your cells. The reason why when you twisted your ankle, you had this nice big inflammation there, is because you broke down some of the cells. Therefore, the cells broke, arachidonic acid came out of the cell, and that triggered what is called the inflammation cascade. Okay. That's the reason why, when you burn, whatever, injury, you get inflammation. But, see, plant-based foods are very low in arachidonic acid. So no problem with plant-based foods. They're not going to create inflammation as long as they're whole, because there's a little exception. I'll tell you in a minute. But the problem comes from any source of animal product, from chicken to egg to beef to cheese and so forth. These foods, the problem with these foods is that they have too much arachidonic acid. In fact, when you eat them, as the body absorbs those foods and absorbs that arachidonic acid, even though you were not injuring yourself, you didn't twist your ankle or poke yourself with a metal or something like that, your body, because of the fact that there's too much arachidonic acid circulating in your body, will trigger the cascade of inflammation. And you will have that chronic inflammation. Now, what I'm surprised today is that sometimes you go to the menus and you will see, animal product, breakfast choice, animal product, lunch, animal product, supper. Man, you are playing a dangerous game. You're putting wood and wood and wood and wood to the fireplace, and it is just a matter of time when those flames are going to start creeping out, and I can tell you, this is not going to end up very pretty. And that's exactly what we see when we check, the causes of death here in Kenya. You can trace half of them are directly related to chronic inflammation.
Now you have actually even made it more complicated a little bit by saying that we can eat, in almost eating our way into inflammation. That's something that we really need to discuss, because for sure our bodies can get really inflamed if we're on the wrong diet. And we need to stop right there. Let's take a break and don't move, because we want to unpack this a little further. We'll be right back.
products create chronic inflammation. So if you think about things like sugar, you know, very inflammatory, and so does white flours, you know, things that are very, very refined are things that are inflammatory. So think about it. You know, I mean, if you were to eat this, you know, once a year, it's not that big of a deal. You know, inflammation goes up and then it will go down in a day or so. But think about it. Inflammatory breakfast, inflammatory lunch, inflammatory supper. Man, you are playing a dangerous game. Another common source of inflammation, sadly, happens to be cigarette smoking. Cigarette smoking is extremely inflammatory. In a study done recently for inflammation, it was shown that one cigarette that you smoke will trigger chronic inflammation for more than a day. And beware, you don't need to be the one smoking. If you're next to the person smoking and you're breathing that air, that's going to trigger chronic inflammation on you. Also, a very tremendously inflammatory agent happens to be alcohol. You do not fool with alcohol. Alcohol is inflammatory and cancer causing. Oh, doctor, but I heard that the wine is good for my heart. That's what the people that want to sell it to you tell you. Okay? That's not what the science is showing. World Health Organization has a statement about that, and it says that that type of proof is based more on commercial interest rather than science. So don't be fooled by the commercial interest. You can even do an experiment, you know. You can take your favorite beverage, you know, what's going to be? It's going to be alcohol, it's going to be beer, it's going to be vodka. And you got a paintbrush, you take some of that alcohol and you paint it on a mouse many times in a day. You will have a cancerous tumor in a few weeks. As simple as that. You can do that experiment yourself and see it with your own eyes. Another thing, excess sunlight. Beware, Kenyans, you guys have wonderful sun here. But too much is problematic, okay? So how do you know you got too much sunlight? Inflammation, redness, you know, swelling, pain, and you know the symptoms of inflammation. Beware, you know, if you see those symptoms of inflammation, you got too much sunlight. You need sunlight. You know, I'm not against sunlight, but beware of that. Another sadly common source of inflammation here in Kenya happens to be overweight, obesity. Okay, if you have excess body weight, the cells that contain your fat in your body, they are sending signals. And one of the signals they send, they turn on the chronic inflammation. And the second source of that inflammation happens to be those cells, those fat cells, are not very good structurally, so they easily break down. And when they break down, what do we say? You release what? The arachidonic acid, and we get ourselves in trouble. So we need to be careful with that. And as we mentioned, you know, animal products, you know, tremendous source of inflammation today.
Now, I'm just thinking of this person who is at home in somewhere in the village and they are cooking using open smoke. Would this smoke affect them? Will it make their bodies to be inflamed?
Absolutely yes. And that's why, you know, as a doctor, when I hear certain lungs, I know that person either smoke or they were cooking with a flame inside a closed space. Exactly. Those lungs are exactly the same. If I take X-ray, you know, there's a certain you see some changes in that lung. You see a lot of damage to that lung on the X-ray. You show me the lung of that person, you show me the smoker lung, the same story. And that's why those people are also at increased risk for also a cancer of the lungs. So, doctor, am I gonna cook the raw diet or what? No, you know, you need to cook your food, but do it wisely. Do not cook inside of a closed space, okay? You do that outside, you know, where the smoke can fly out. It is a huge mistake, and yes, I've been to Tanzania and Kenya and seen that very much. Many people do this. That is a really, really bad idea.
And you know, sometimes we have seen people get these cancers and they never know because they don't smoke. But they cook inside, so that was very helpful. Then I'm also thinking about this person who takes alcohol and maybe believes that it's a source of antioxidants. What do you have to say about that?
That's right. So, you know, antioxidants are found throughout all the vegetable world. So by some reason, the alcohol industry tries to program your brain to think that you need the antioxidant that is in the alcohol. Why, if there are thousands and thousands of options, I need to depend on that one? And the thing is that I get a bad deal. See, in medicine, we always need to do prescriptions and so forth, in which we evaluate what is called risk-benefit ratio. Am I going to get a better benefit to the risk that I'm putting the person? You know, because every medication has a side effect. So when you see the situation with alcohol, you're getting a bad deal. You're getting a worst risk factor for cancer and dementia and other problems than the benefit that you're getting from that resveratrol. In fact, very interesting published study that came out a few years ago, in which they were demonstrating if you want that antioxidant that is there, if you drink the grape juice, the one that has this purple dark color, it has exactly the same resveratrol that you find on the wine, you know, without the cancer-causing potential that the alcohol has. And also, sometimes the alcohol industry, they're not honest. I can tell you, you know, because I read all the time the scientific literature. For example, recently they did a study, and the conclusion was, you know, alcohol drinkers are have longer longevity compared to non-drinkers. And I said, that's interesting. Let me read the study how it is. So I went and saw the details of the study. They were comparing people that have been damaged by alcohol so much that the doctor said, you know what, you don't drink alcohol, absolutely no more, okay?
Stop.
So those were the group of non-drinkers.
Okay.
And then they compare that to a younger, you know, group of drinkers. Of course, you know, the drinkers were much healthier compared to this one. But what does the press do? The press goes and sees this one, and man, they run crazy. And you're going to see it on the internet, on the newspaper, on the nightly news, and so forth. And I can tell you why. Because there's a principle that says people like to hear good news about their bad habits.
Yeah.
So if it encourages their bad habit, man, the press goes crazy. So beware of fake news.
Yes. Yes, that actually helps us to understand that we should actually interrogate our sources of information. And I'm just thinking of this person who would be worried maybe about the kinds of foods that they eat. Maybe they prepare. You know, we don't do a lot of spices in this part of the world, but we enjoy, of course, to have spices in our food.
Yes.
Would that also be a source of inflammation?
That's a very good question. And, you know, spices are actually an excellent source of anti-inflammatory agents. But the research shows a U-curve, which means that if I don't eat enough spices, I actually increase risk of certain cancers because I need those anti-inflammatory agents. But at the same time, if I'm eating too much spices, you also increase the risk of cancer. It's a U-curve, okay? And why is that? Because things that are spicy create irritation And if it creates irritation, what is going to trigger? Inflammation. So you need to be aware of that reality. You need to be careful. Spices, it's okay, as long as we give flavor. And there's certain spices you shouldn't use, period. For example, black pepper, white pepper, to the garbage can. They're no good for you, extremely irritating, and sadly very commonly used among people. But other spices, such as turmeric, tremendously anti-inflammatory agent. In fact, the first time in my life that I saw the root of turmeric was in Tanzania, Zanzibar. They had a plantation there. And that's something that you should be eating, a couple of times a week, every week. Some people say, well, doctor, should I take the pills? I would rather you enjoy it in your food. Yes. It gives a good flavor, that type of spice. And at the same time, it has, all these benefits and anti-cancer and anti-inflammatory effects.
And does this completely throw out the black pepper, for example? Sometimes you find you can use a little, like a quarter teaspoon of black pepper and turmeric.
That's right.
To open up the curcumin, only that you don't make it a habit.
That's right.
Or maybe you don't put excess black pepper.
Yeah.
Would this mean that maybe all spices, because I find other spices that are dangerous, which you probably don't want to have in your house completely. Would you have amounts of how much you can have of some of this? Because we like white pepper in our food.
That's right.
Good news about our bad habits.
Yeah. So research shows that when you add a little bit of black pepper, there is an increase in the potential absorption of the turmeric. But in my personal opinion, the risk-benefit ratio goes, that's right, on the risk side of things, due to the irritation, And the problem is today, it's very common problem, stomachal problems, digestive problems, very common cause of complaint of the people. So, I mean, if once in a year you eat something like this, once, twice a year, it's not that big of a deal. But as a regular thing, I don't think that would be a very good idea.
Oh, okay. Now, what about someone who wants to stop? Their body is all red, it's all hot.
Yes.
What is it that you can tell them?
That's right. So we need to start always with the mind.
Yes.
Did you know that stress causes inflammation also? So we need to learn principles of cognitive behavioral therapy. I suggest you go to my website, drediramirez.com. I have a couple of videos there dealing with that aspect of things. There's an excellent book. I suggest you Google it on the internet and read it. It's called Steps to Christ. Man, powerful book. Absolutely powerful at helping the person come to a peace of mind. There's many people with a lot of turmoil and unforgiveness and these type of things. Those types of feelings are not conducive to lower chronic inflammation, I can assure you. Because all that stress is triggering that chronic inflammation, and you need to deal with those aspects of things. And then what are we going to do? Well, we need to switch to a whole food, plant-based diet. And that whole food, plant-based diet needs to be, what I tell my patients, it needs to have the rainbow on it. So if you see, fruits and vegetables, you will see that there are different colors on them. And you guys are so blessed here in Kenya because you have access to all of them, So you have the ones that are black, the ones that are purple, the ones that are blue, the ones that are red, the ones that are orange, the ones that are yellow, the ones that are white. Make sure you eat the whole shade. Each shade has different phytochemicals, which are chemicals that are only found on plants. They have been identified, more than 3,000 of them, and have tremendous beneficial effects on our health and to decrease the inflammation.
Wow. Thank you so much, doctor. We have learned, at least the way out is color your plate. Have it all colored have as much as possible plant-based diet and avoid stress, forgiveness, seek to be at peace with yourself and those around you. We'll be right back after the break, so don't go away. Welcome back. This is Afya Fix. I'm glad you're still there. And we have our guest, Dr. Eddie Ramirez, lifestyle medicine doctor, international speaker, and researcher who we're so glad to have him here, Dr. Ari. And we have our live audience who are now ready to ask questions. So at this time, I want to go to the floor and we're going to have our first question.
My name is Bosbori Nyamongo. I've learned so much today about inflammation. I have a question. I have a friend who is suffering from osteoarthritis. Is there a way she can reverse it? Can you advise, please?
That's a very good question and happened to be a very common question, you know. So we talked about a little bit about the etiology, you know, where this came from. So osteoarthritis has different levels, you know, and the more we don't do something about it, the worse it's going to get. Just taking pain medication actually doesn't solve anything, you know, because you're not dealing with the root cause of the problem. So what we need to do, we need to deal with the root cause of the problem, which is chronic inflammation. So we need to analyze, you know, what type of things she may be doing that may be contributing to that chronic inflammation. Also, we need to understand that there's something interesting happening in our body. When there is chronic inflammation, actually you feel more pain. So this is something that I have observed. You know, I have 24 years of working in lifestyle centers. And when we switch the diet of the patient to a whole food plant-based diet, many times the reported pain of the patient, they say, I don't know what's happening to me, you know, I actually feel much better. And another very essential thing, cartilage, when we move our cartilage, it creates an effect that brings nutrition and oxygen to the area and releases the toxins of the cartilage. So somebody that does not do exercise, is at very high risk for osteoarthritis. And at the same time, even if you already have the osteoarthritis, it may feel painful and so forth, but research shows if you don't move that articulation, it actually is going to get worse. So you need to move it in order for that pain actually to be less and to stop the process from continuing destroying your articulation. And finally, something that she could do, she could put some hot fomentations on those joints that helps to calm down the pain and so forth. And if they want to do something at night, they can sleep with a charcoal poultice. How do you do that? 2 parts of activated charcoal with 1 part of flaxseed, a little bit of water, make a paste, put that in the knee or the hip or whatever it is. Make sure you enclose it nicely because it can stain nicely your sheets. And the deformation of the cartilage, we cannot do much about it, but we can stop that from continuing further.
And so that means if you have any osteoarthritis, it's not an excuse not to exercise.
That's right.
So move the body.
Exactly.
Let's have the next question, please.
How are you today?
Good, good.
I'm happy to be here. My question is, if you look at generally in the world now, many people are dying of diabetes.
Yes.
Is it possible that we replace sugar with honey as a sweetener for diabetic patients?
That's right. Good question. In the diabetic, actually, insulin resistance causes inflammation also. So beware of that. That's why a diabetic needs to be under control as soon as possible. You know, don't wait, you know, next year or something, you know. And yeah, you can actually go back to our recorded programs, and you can see some of those programs dealing with that subject. So what about can the diabetic use honey? You know, that's basically the question. So the answer is yes, in moderation, and as long as when they eat that, they are eating a high fiber food such as legume. You know, you're talking about beans, lentils, chickpeas, these type of products. Because honey by itself, if you just give honey to the diabetic, the glucose is going to go up. Okay, it will have a very similar effect to the sugar. So what impairs foods from causing the blood sugar to go up happens to be fiber. So foods high in fiber, when they come to the digestive tract, the body needs to work hard to take those sugars out of that fiber, and that makes the sugar go slowly in your bloodstream. But when you eat sugars and honey, honey doesn't have fiber, therefore, you know, will enter very fast into your bloodstream. So again, you know, they should be stopping, you know, animal products and go to that wholesome diet. That's the best way to help that diabetes.
Yes, so you can have a little, but make sure your fiber is besides you. Thank you. That's a good question. Let's have another question.
Thank you very much for this chance. My name is Evelyn. I have two questions, Dr. Ari. Question number one. Kenyans, most Kenyans, when we fall ill, especially of cancer, we run to India.
Okay.
You have just enlightened us that too much spice is not good. We know that most Indians, most of us cannot dare eat their food, or if you eat, you will not enjoy it. How about that? What's the relationship, or why is it that we run there yet they're the ones who are using too much spice? Does that make sense?
Yes, it is.
Thank you. The second question is, I think you partly answered it, but I probably would love more for you to shed more light. When inflammation comes to our bodies, we are so quick. When we go to hospital, the doctors are so quick to administer painkillers that will make sure the pain goes away, the soreness go away, and things like that. And here you are telling us that diet should be able to resolve that. And definitely diet will not do it at an instant. It will take time. I'm sure this is information that our doctors know. Why is it so difficult for them to just tell us the truth that, Gafna, whatever you're suffering from, this will do away with the pain instantly, but we would rather you start adopting ABCD, whatever diet they will prescribe to me. Thank you.
Yeah, so those are very good questions. And yes, it's very interesting that when you check statistics, cancer rates in India tend to be lower. And one of the reasons why is because many Indians are on a plant-based diet. Okay, so their amount of animal products in the country, they do eat, you know, certain areas eat meat. I've been to India a few times. I lecture there, have many friends. I still do research projects with them. And yes, you know, it's that factor that the Indian philosophy, you know, encouraged that plant-based diet. In fact, anywhere you go there, you know, you have the what they call the veg option. They call it, you know, the option with the vegetarian. But sadly, the society of India is changing, and animal product consumption is increasing. Processed foods are increasing, and also they're starting to have an epidemic there of metabolic syndrome. Lots of new cases of diabetes and these type of things. And sadly, cancer is also on the rise. So when we understand the situation, it's many factors that play a role. So what I am telling you today, I'm telling you what's the ideal. How much of the ideal is up to you. But I suggest you get as close as possible as that.
true.
Because as you start veering off, you start increasing risk factors, and then we end up losing, the battle. So yes, that will be a potential solution to your question. And the second question, what about trying to solve inflammations with medication? Basically that's the question. This is the funny thing. We have anti-inflammatory agents today, pharmaceuticals. But the funny thing is that when you shut down inflammation through one of those agents, you shut down part of it, but something else turns on. And now you get an ulcer, and now you get a liver problem, and now you get the kidney problem, and so forth. So there's no shortcuts, You have to deal with the root cause of the problem. And ask yourself, be honest with yourself, what am I doing that may be triggering this? Like this study that you can see on the screen, fascinating study. In the study, I'm quoting textually the study, it says that the association between animal consumption and cancer is as strong as the association between smoking and cancer. That is how carcinogen animal products are, and now you know why. And the answer starts with an I. What is the answer? Inflammation.
Inflammation. Ooh. Wow. Thank you so much. And now that actually helps us to understand why we must choose close to the ideal. We don't just make any choices. And we would like to take another question from the audience and see how best can we make sure that our bodies are actually not inflamed. So let's have a fourth question.
Thank you very much, Dr. Eddie, for such a powerful presentation. Recently, I have seen so many people getting brain tumors. I don't know whether this could be related to what we are discussing. And I just wanted you to shed some light on that. Is it something, because I have a friend who all her life, she has never been sick, serious sick illness. And then all of a sudden, she has this brain tumor.
Sorry.
Yeah, so could you please shed some light on that? Thank you.
Yeah, there's some interesting research on that subject. For example, regarding brain tumors on children, there's some research that show that eating processed meats, like this salami and these type of things, due to their high, nitric stuff that they put as conservative, the children of those pregnancies are actually increased risk for brain cancer, So that's regarding children, And what about adults? Yes, the source of the problem happened to be inflammation. Something was triggering that inflammation. And one potential source of that would be the animal product consumption, Animal product consumption can trigger all kinds of problems. And also, another parenthesis here, many times the hygiene and the way that we handle animal products here is not the best, They kill the animal, they have it hanging there, no refrigeration, all the flies, all the dust, all the stuff falling on it, just like that, And also the quality, many times, in other countries, at least they have some certain standard to avoid parasites and so forth. Many times those type of things are not checked here. So you have even higher possibility, of eating one of these dangerous parasites that can even go to your brain and cause all kinds of problems and so forth. So yes, part of that equation happened to be a problem with inflammation. And yes, this type of tumors, we're seeing them more and more around us. So that's why, even here, the pollution and all those things. So it's like a battle, as I tell my patient. You have anti-inflammatory agents and you have inflammatory agents. So who's going to win in your life, Are you going to have more things causing inflammation than things that stop the inflammation? So one of the things she needs to do, tell her to Google. There's a nice free manual. It's called the Survivor's Manual, PCRM. Google those three words. P as in Peter, C as in California, R as in Rose, and M as in Mary, PCRM. Survivor's Manual, PCRM. It's a free dietary guide for people that are struggling with cancer. I'm not saying that this is going to be the only treatment. You do your own treatment and you complement it with a good nutrition.
This conversation does not end here. So you can be part of us. You can join and follow up in our Twitter handle, Hope_Kenya. You can go to the Facebook page, Hope Channel Kenya, and our YouTube for later viewing, Hope Channel Kenya as well. And there you will be part of us. Also, you can call us on the numbers displayed on your screen if you want to be part of this live audience or any question that was not addressed, and we will be very glad to have you on board and also answer your question. I've been your host, Gladys Ombongi, and for now, it's bye-bye. Asante sana.